Hello, everybody. My name is Seven Song. Yes, friendly wave. Why not? Don't need to get right into business. My name is Seven Song. I'm a clinical herbalist who lives in Ithaca, New York, but who has an accent from downstate New York, where I spent formative years. It's an interesting term, formative. I run the Northeast School of Botanical Medicine, and I've been doing that since 1992, 1993. I'm starting to wind down running the school just for a few more years. One thing I wanted to share, which I assume many folks know, is that I recently put an online herbal database. I put a free herbal database online recently. So if you're interested, if you go to my website, sevensong.com, and just look at the top bar, the navigator bar at the top, and it'll say herbal database. I would really appreciate if before you use the database is to please read the safety section. My biggest concern, even including today, my biggest concern about offering information is that it can be used in a way that harms people. Herbal medicine, of course, is not without secondary and adverse effects. If you just think about pollen, pollen comes from a plant, and many of you are probably watching this because you have allergies to pollen, or maybe you have allergies to plants. So please read the safety section. I spend a lot of my experience comes from two places. One of them is the Ithaca Free Clinic, which is an integrative free clinic, which I've been working at and one of the founders for 19 years now. So if you're an herbalist on here and you're interested in starting free clinic work, you can go to the website Ithaca Free Clinic and learn what we do. A kind of a warning, we're kind of a traditional stand-up free clinic. In other words, we're not a pop-up free clinic. The real difference in this clinic is that it just has more alternative types of medicine. And it's one of the few free clinics in the US that has doctors and nurses and an herbalist and an acupuncturist, et cetera. And the other place I've gotten a lot of experience, the place I've gotten a lot of experience with allergies is working at first aid station at outdoor events. There's just, boy, if you work first aid, you learn very quickly that probably within the top 5 to 10 things that you'll see at an outdoor first aid station are allergies. A lot of the allergies are to environmental allergens, things like pollens. So you start to acquire the tools to help people reduce the symptoms of their allergies. Today's class is going to focus on what are called seasonal allergies. Technically, the class today would be called type 1 hypersensitivity reactions or immediate reactions. Commonly, this is called seasonal allergies or hay fever, or the most common name of all is just allergies. But there's actually 4 types of allergies. For instance, poison ivy is a kind of allergy. That's why not everybody gets poison ivy who touches it. You have to have a kind of trigger in your immune system, we'll come to this, to get poison ivy. So today's class will only be covering seasonal allergies or type 1 hypersensitivity reactions. These are often called immediate allergies because within minutes of coming into contact with the allergen, the thing that causes the allergy, you start to have symptoms. So what this class won't cover today is the other types of allergies. I'm not going to be talking about all the different kinds of allergy medicines. And I'm not going to go into depth about the physiology or pathophysiology of allergies. It's fascinating. And frankly, there's a lot of excellent resources and online animations about what triggers. And I'll go over it a little bit because I think it helps to understand the pathophysiology, the sequence of events that causes allergies for so many people. All right, sip of tea. So first, a simple definition. So what is an allergy? An allergy is an immune response. So whenever you study allergies, you're not looking at the respiratory system, you're looking at the immune system. So basically, what an allergy is is a strong reaction to a generally harmless or benign substance, right? So for many people on world, shellfish or latex gloves or pollen or mold spores do not create a reaction. But for a sizable amount of the population, they do. But what's happening, and this is fundamental to understanding allergies, is what's happening is your immune system is detecting these foreign substances and deciding that they're problematic in your body, and it mounts a defense. So you're sneezing and itchy eyes and runny nose. All of these are because your body thinks that pollen is a problem for you. All right. So again, that's it. So the most common allergies, so you cannot be allergic to many different things. When it discussed the difference between allergies and things that look like allergies but are not allergies. But first, allergies. So pollen, often called hay fever or seasonal allergies, is one of the most prolific of all the allergies. Next, these are not in order. Next is mold. And there are two ways people are allergic to mold. One of them is through the spores that get released when the fungi are releasing spores. But the other way that people are allergic to mold is due to the volatile compounds it releases. You've all smelled it, right? You've gone in, you've opened an old book and you can smell the mold, or you go into a part of your house and you smell the mold. For many people, those are volatile compounds emitted by fungi, and many people are allergic to that. So the mushroom, the fungi, does not have to be sporing in order to create an allergic reaction. Next are foods. I mean, just some of the foods would be milk, eggs, fish, shellfish, tree nuts. There are many, and some people have very idiosyncratic allergies to foods. Um, but food in particular have gone up a lot in the past 20 to 30 years. The amount of people suffering anaphylaxis, which we'll discuss, from food allergies has risen considerably in the past 10 to 15 years. There's many more hospitalizations due to bad reactions to food, and that seems to be on the rise. Other things people are allergic to are medications. Antibiotics and aspirin are two of them, but you could be allergic to many different medications. Again, though, one thing that's important to remember throughout this whole class is I'm talking about allergies and not systemic reactions. Like if you read the black box label of a medication and says something like, if you take this, you might have nerve pain in your foot. That is not an allergy. That's a direct reaction to the medication that some people have and some don't, often for no apparent reason or no known reason. More things that create allergies are insect bites. So of course, everybody gets insect bites, but not everybody reacts the same way to insect bites. This can happen in two ways. So one form of allergy to insect bites is just what's called a wheel and flare, or very strong reaction. So you get bit by a mosquito, and instead of just a small bump and a little bit of itchiness, you get a very large raised area, and it becomes very itchy for quite a long time. And of course, the other kind of allergy to insects are to the class of insects called Hymenoptera. The Hymenoptera are these bees, the wasps, the yellow jackets, the hornets, ants. The problem with insect stings in particular is that they are injecting the venom subcutaneously under your skin. So it's different than breathing in pollen or eating a food, which gets broken down in your body differently. When you get when a bee stings you and you're allergic, that venom, which for many people is just painful and not a long-term problem, but it's going underneath your skin and your body has a much stronger reaction, which is why people have anaphylactic reactions. Again, we'll talk about anaphylaxis later, to bee stings. A few more. So the next are dust mites, those lovely, lovely little dust mites. You could probably get, let's see, you probably get like, I don't know, maybe 500 dust mites, so probably about 200 dust mites on the tip of your finger. Dust mites are little arachnids, kind of tick creatures that eat our discarded skin flakes and other animal flakes. And basically, they're just prevalent inside. They love warm, humid places. So mattresses and couches, places where you're sitting and shedding skin flakes. something maybe we can all visualize for a few minutes. Sitting here, breathing deep, shed some skin flakes, make 100,000 dust mites very happy at that moment. And then what happens, of course, like all things, it eats and it poops. And its feces are actually what we react to for the dust mites. So they're very tiny, they're airborne, you sit on it, goes up. It's one of the reasons why if you're allergic, one of the main things to do very regularly is to wash your sheets, vacuum furniture, or just have wooden furniture or plastic, yuck, furniture, because it just prevents the dust mites. The next is animal dander. So we're not generally allergic to the fur or feathers of animals. We're allergic to the products on those furs and feathers. And those furs and feathers might also have bits of urine and saliva on them. So that's why it's not an allergy to fur, it's an allergy to animal dander, because it's pieces of protein shed off by the animal that's in the fur. Next is latex products. The reason that people are allergic to latex products is actually your reaction is to the rubber tree. Latex is made from a tree, the rubber tree, and some of the proteins in the rubber tree, for some people, reactive. It happens very often for people who work in hospital or other settings where you're wearing latex gloves more often, which are less frequent now, because you're just constantly putting them on and off and you're starting to sensitize yourself to it. All right. I hope folks are following so far. That's our very quick introduction. Next, the difference between autoimmunity and allergies. So autoimmunity, things like Sjogren's syndrome or lupus or rheumatoid arthritis, share a very similar aspect to allergies and a very different aspect to allergies. So an allergy is a reaction to an exogenous substance, to something outside of your body, whether it's dust or animal dander or dust mite poop. That's what your body's reacting to. Autoimmunity or autoimmune diseases, again, like lupus, is your body reacting to endogenous substances, whether it's your thyroid or your pancreas or your knee joint. So both autoimmune conditions and allergies are both hyperreactive situations to normally benign substances, but the allergy is to exogenous or outside your body sources, and autoimmunity is a reaction to in-body or endogenous sources. All right. So in case I should say this, what I'm going to do in the beginning is talk about what allergies are, and the second half of the class will be you talking about the herbs, something like half and half. I'm not sure yet. Next, what I want to do is I want to separate allergies from things that look like allergies. The reason that this is important is because how you treat these other things, it's because of treatment. I'll just go on, it'll make more sense. So what I want to talk about are common symptoms of allergies compared to common symptoms of things that look like allergies. So first, allergies tend to have clear mucus or opaque, kind of whitish mucus. Allergies don't usually have yellowish mucus. The difference is when you wake up in the morning and blow your nose, it's often darker colored because the mucus has been sitting in your nose for a longer period of time. So it's just like pee. Like you want to have clearer pee, not necessarily clear, but in the midday. But when you wake up, your first urine is often darker because it's been sitting in your bladder for longer. The same is true with mucus. So the reason I'm saying this is you don't want to deduce what kind of ailment you have by morning mucus. Morning mucus. So in general, allergies have clearish or whitish mucus, rarely dark colored mucus. There's rarely fever associated with it, and generally no things like joint pain as well, or even headaches. We'll keep going with this. One thing that's going to be a little important that we'll get into, though, there are two stages to allergies. This is going to be subtext, and I'll get into it. So allergy often has two phases that I need to discuss right now. So they're called early phase and late phase. The early phase of your allergies are those immediate symptoms that we'll talk about in a little bit. Stuffy, mostly face stuff, right? Stuffy, itchy, that kind of thing. Late phase reactions, for those of you who have late phase reactions, often you have swelling in your body, you're much more congested, and you might be fatigued. I'm going to discuss these later, but the reason I'm saying this is that late phase reactions to allergies, this swelling and fatigue may look a little bit like something else, but you'll know that it's a late phase allergy because you had an early phase, right? So right now you're very stuffy and swollen. And you're wondering if you have a cold, and then you think, oh, 5 or 6 hours ago, actually I was very sneezy and very runny nose, and the back of my throat was itchy. So that's how you would know the difference there. Again, a lot of these things can be broadened out with time. Next, so how do you know it's not a cold or a flu? The way to know that, one of them is the color of mucus. So if you actually have an infection in your body, which colds and flus are respiratory viruses, often the mucus is a darker color. So one way to know you have a cold or a flu is darker color mucus throughout the day. And then the things that are associated with it. You might have a headache. There's a good chance of having a fever, more of a chance of having a fever, with a flu, joint pain, fatigue, lack of appetite. So those tend to say, and also you haven't had the precursor of the other symptoms. Like all of a sudden you get a wave of, feeling ill and having a hard time getting out of bed, much more mucus buildup. But one way, again, is just looking at the color of your mucus might be helpful for some people. Because colds could be kind of minor, right? They can just come and go within a few days and not be very symptomatic. So we have colds and flus versus allergies. Next, we're just going to have dust and irritation. So again, working at outdoor events, a lot of people are just in contact, especially children. I don't know if you ever do first aid, or just do this. If you're ever at an outdoor event, you probably do, all your parents do this. If kids are playing someplace, it's really good to go, if you're taller, even if you're not taller, go on your knees, because you'll see that the dust is child height, right? So a lot of children are looking like they have allergies because they're playing, but actually it's a lot of dust. So again, when you have dust irritation as opposed to allergies, generally you have lighter colored mucus. And most of your symptoms are just very itchy in the face. They tend to not be as runny. But really, you're just going to look at the environment. The other thing about dust irritation is usually if you drink your water and wash your hands and face, it'll resolve much quicker. The last of these is probably the most important, and that's the difference between food allergies and food intolerances. Sometimes intolerances are called sensitivities. These are pretty different. So generally, how to tell the difference. I mean, you can have both. You can have all of these. You can get a grand slam or whatever, and just get lots of symptoms from many things. So I'm not sure why I'm smiling and laughing at that. That's not very fun. I'm just saying, though, this is not limited. You're not limited to just one of these categories. So food intolerance versus a food allergy. So food allergy will have all the things I'm going to discuss over and over again here, which is going to be things like sneezing, runny nose, itchy eyes, itchy ears, cough. Again, I'll go over these symptoms over and over, but I want to compare it. Food intolerances tend to be very digestive oriented. They tend to be things like diarrhea, gas, bloating, crampiness. So some people's food allergies does affect their digestive tract, but in general, you're also going to have all those facial symptoms. And so the reason for knowing the difference, once again, is treatment. So for instance, if people have food intolerances, really the most important thing will be avoiding those foods. But also if you're treating like food intolerances, often you're giving anti-inflammatories, you're giving things like chamomile and catnip and meadowsweet. You're really trying to settle the digestive tract. When you're treating food allergies, you use different plants. So a little bit more of introduction here. So allergic reactions are very common. Um, I mean, there's lots and lots of different numbers, but at least 50 million people have allergies in the United States. It's really going to be much higher than that. It's like a third to the fourth of the population of the US, people who occasionally have allergies, and many of them will have constant allergies. One of the reasons I like talking about allergies as an herbalist is that there are some herbs that we'll eventually get to that can be helpful for the allergies. So it's helpful to understand, like I'm going to cover it very basically, but it's helpful to understand the pathophysiology. Pathophysiology just means what is happening in your body that's causing your symptoms. Physiology is how your body works. Anatomy is the structures of your body. Pathophysiology is what's gone wrong that's causing you to be so sniffly or whatever health condition you're working with. One thing that's going to be, I want to drive home now, I'm going to drive home over and over and over again. The worst case for scenario for allergies is what's called anaphylaxis. We're going to be talking about this more, but ana means up or against. Phylaxis means protection. You hear the word in prophylactic. So what happens in anaphylaxis is a much stronger reaction that can lead to difficulty breathing on cardiovascular collapse. Your blood vessels dilating and blood moving out. Again, we'll come back to it. Here's the thing, though, I want to say. No herbs help for this. You need to have an EpiPen and you need to have it on you at all times. I know the prices of them are crazy and stupid and it makes one so angry at the medical system. So, but that's what's life-saving. You don't have to, by the way, use an EpiPen. There are multiple kinds of epinephrine injectors. And if you're comfortable with it, you can buy epinephrine. Oh, by the way, epinephrine is another word for adrenaline. They are synonymous terms. Epinephrine and adrenaline are exactly the same thing. So you can actually buy adrenaline in a small ampule. They're pretty inexpensive, and buy a syringe, and it'll be very inexpensive. The health professionals I work with sometimes use that because of saving a lot of money. I don't. I'm just not that competent doing that. I don't give out syringes very often. But that is something you could do if you know how to do that. And also, again, there are multiple kinds of epinephrine injectors. I would suggest often they come with a tester, and then you can learn how to, so the needle actually doesn't go in, but learning how to use them. But I can tell you doing first aid, they're absolutely life-saving. So the other thing you need to carry with you is Benadryl. So there are two classes of histamines. I think I'm talking kind of fast. Sorry. There are two classes of histamines, of antihistamines, excuse me. There's the old ones like Benadryl, and then there's the newer ones that don't make you as tired. But you want the older class. What's it? Diphenhydramine. Benadryl. Don't buy Benadryl. Buy its generic. I think it's called diphenhydramine. Because you're going to give that alongside of it. First, you give the injection. I don't want to. I would just really suggest learning how to use an epi injector and carrying Benadryl or diphenhydramine. That's sold over the counter. It's very inexpensive, but it's really helpful. It's life-saving. It's not just really helpful. All right. One thing that can be challenging is trying to figure out what the allergen is. I mean, sometimes it's obvious, like a bee sting is obvious. But I do want to say that a lot of the people I see, mostly in the free clinic, not so much in first aid, they really don't know what their allergy is, and nor do I. And sometimes it's really hard to figure it out. I'm not talking about food intolerances. I'm talking about allergies. So there are basically two main concerns with allergies. The first is anaphylaxis, that potentially deadly reaction where your immune system just causes a bunch of reactions that can kill people. And the second problem with allergies, which is much more common, is just day-to-day quality of life. I mean, allergies are miserable. Um, right? So basically, it's springtime. It's springtime. It's glorious. It's today's even sunny here, and you go outside and you're starting to react to all the tree pollens. The tree pollens are going to be the first to cause reactions because the trees, almost all trees here in the Northeast, most trees are wind pollinated. They're not insect pollinated. That means the pollen is blown in the wind. That means for that tree to pollinate, to fertilize, it's going to make tremendous amounts of pollen because it's not an insect is going to go plant to plant, take the pollen, move it here, take the pollen, move it here. Trees don't have that. So the wind blows, so they make lots of pollen. And a lot of people are allergic to different pine pollens, spruce pollens, birch pollens, alder pollens. Um, right. So not much fun, but probably the best way to avoid it while still going outside is just wearing a face mask if it's obviously polleny outside. It's really, as we'll get to in a bit, avoidance is really the only way to stop most allergies. So a good quality N95 face mask will help a lot. Even a paper face mask will help some, as long as it's covering your nose as well as your mouth. Next, why are allergies on the rise? It's not very clear why allergies are on the rise, but one of the prevalent concepts is what's called the hygiene hypothesis. The hygiene hypothesis basically says that we live in a very sanitized world. Not everybody. So just, of course, just put in whoever lives in a more sanitized world. So this hypothesis happened after it was noticed that people who were living in more urban environments were having more allergic reactions and people in rural environments having less allergic responses. Also, people who lived multi when there were more than one child in the family, when there was lots of children in the family, there was also less allergies in that family. So the concept here is that we're born with kind of an immune system that's ready to fight problems, pathogens in our body. And for almost all of our history, that immune system has done so, right? We're eating dirt because we're picking plants and eating them. Nobody is taking the drug. All right. So before I go further, I need to say that what I feel like I'm about to rant on, there's a secondary part to this. So I'm going to cover it now. Many of the things that have helped sterilize and sanitize the world, sterilize is the wrong word, sanitize the world, have saved millions and millions and millions of lives. So I was about to say, well, as I go to say this, that our over-sanitized world makes allergies, I do want to say antibiotics, for instance, save multi-millions of lives a year over and over and over again. And people I know have been saved. Like everybody knows somebody's lives have probably been saved by antibiotics. So I've said that. Now I want to say, but due to this excess sterilization and sanitation, our immune systems don't have pathogens to fight. This is the basic concept. And so what's happening is that they're reactive to benign substances like pollen or animal dander or dust mite poop. So you just kind of think like your immune system is in there. This is anthropomorphizing our immune system, but it's in there, it's ready to fight, and there's nothing to fight. And all of a sudden it gets a small amount of trigger, and this thing that's kind of been wound up moves into action, and then you start to have the symptoms of allergies. So some of the reasons for this, some of the things that we've taken out have been worms. It's probably great that we don't have worms, but there's been interesting experiments with people taking certain kinds of worms, helping their allergy load go down. I am not recommending this, but you can read about it if you like. Overuse of antibiotics has certainly led to alerts. Excessive personal cleanliness, not letting any bacteria ever, just washing with soap too much. And at the base of much of this is our degraded gut flora. So kind of one bottom rung of why we have this is that for some reason, as we've lost the amount of species in our microbiome, in our gut flora. And as we've lost the diversity, not just numbers, but the diversity of our gut flora, it looks like people who have reduced gut flora, but diversity, are more susceptible to allergies. So these are just some concepts to work with. I'm not really suggesting eating worms. I'm not suggesting eating unsterilized food, but I am saying that these are this is one reason. There's lots of loopholes, by the way. If you look at the hygiene hypothesis, there's lots of ways to take it apart. Next, so the hygiene hypothesis basically says excessive cleanliness has led to a more reactive immune system. To put into more, just a few words. Next, if it's not apparent, depending on what community you serve as an herbal person, underserved communities have way more allergic responses. I just want to speak to that because I think it's important to understand why. So socioeconomic factors play a big role in allergies. The prevalence, by the way, is amongst everybody, but in places so people who are underdiagnosed, undertreated, have delayed treatment, have more exposure to environmental toxins, often have more allergies. So if you have access to medical care and you have allergies when you're a young person, you'll be seeking regular medical care. And within that regular medical care, you'll be being treated. So in other words, you might still have symptoms, but your symptoms are abated quicker. Now, you live in a place where you have access to medical care. You lack access to medical care. And you just don't have the money, the resources. There's no clinic near you. So you're going to go to the emergency room. Let's say if your child is having a really bad allergic asthma attack, and they're going to treat it. They're going to treat it aggressively, but you're not going to get medicine for it later. So each of these worst case exacerbations predisposes that person to allergic responses later. So there's just many reasons why people who lack resources, lack medical access, are more prone to allergies. All right, that's a little bit of the politics. I think the politics are important. Working in a free clinic, often I'm working with people who didn't have access, and now it's just much harder to treat. There are two stages of allergies. This is going to be a quick pathophysiology of allergies. So they're called sensitization and subsequent exposure. You can just say stage 1 and stage 2, but sensitization and subsequent exposure, subsequent meaning the next. So let's start with this. Initially, people are not allergic to anything. You have to encounter the allergen once. There's a few exceptions to this, but they're very uncommon. So what happens is let's go with pollen. The first time you interact with a birch pollen, the birch pollen lands in your nose. An antigen-presenting cell, like a dendritic cell, picks up that protein from the pollen, goes into the lymph system, brings it to the nearest lymph node. In the nearest lymph node, a T helper cell is going to recognize that what's called an antigen now, something that's going to create a reaction. And it's going to signal a B cell and start a cascade of events. Let me pull back one step. So initially, the antigen-presenting cell takes that piece of pollen, brings it to the lymph node, introduces it to a T cell, which introduces it to a B cell. That B cell is then going to make antibodies for that birch pollen. That B cell is going to make, those Y-shaped antibodies that you always see? I'm not sure how to do this. It would actually be kind of like that. Those are called antibodies. So that B cell is going to make antibodies, and those antibodies are going to go into the bloodstream, where they're going to be put onto two kinds of cells called mast cells, M-A-S-T, and basophils. I'll sum this up. I'm going to give kind of the longer version, then the shorter version. So what's happened is you inhale some birch pollen, your immune cells have now made antibodies to it. The next time you breathe in that birch pollen, you have all these antibodies all ready to go. And what they're going to do is it doesn't have to go through this whole process from the first time. Those antibodies are going to cause the mast cells and the basophils, another kind of white blood cell. Mast cell is a type of white blood cell that lives close to your skin. Basophils are a kind of white blood cell that lives in your bloodstream. The next time you come into contact, these antibodies are going to cause the mast cells and basophils to degranulate, break apart, and release their internal substances. These internal substances are things like histamine, serotonin, bradykinin. But basically, we'll just stick with histamine because it's the most wide known and one of the strongest. So the second time you come into contact with that birch pollen and subsequent exposures, your body is primed to react. So this is it. So you have your first stage, sensitization. You got stung by a bee and you swell up, no big deal. The next time you get stung by a bee, the antibodies that have been formed to the toxin in the bee venom react quickly and will have a stronger reaction, whether it's more local or more systemic, leading to anaphylaxis. So this is these two steps of allergies. I hope that makes a little bit of sense. I apologize for talking fast and for not reading your questions, but I want to get through a bunch of stuff, and then if we have time, I'll go through the questions. I apologize for that. All right. Did that make a little bit of sense? So yeah. So basically the first time, your body learns to recognize it, and the second time, it reacts, and then the third and the fourth and the fifth time. There's also some holes in this whole idea. I've met numerous people that stopped having allergies over time. No reason why. Sometimes, of course, if you move, you might not have allergies. So let's hope that for as many people as possible. Why do people get allergies? There's most of the time people don't know. But a word that you might see a lot looking up about allergies is the word atopic, A-T-O-P-I-C. If you are atopic, it means you have a genetic predisposition to allergies. It can come from either parent or some other gene coming from further down the line. So a lot of people are atopic. Atopic allergies tend to be more in the face, the runny nose and all of that. And also hives and itchiness are very common with atopic allergies. Many people switch. This might have happened to you. So when you were young, when you were a pre-adolescent, you had rashes, right? You had constant rashes. They tried lots of stuff, steroids and different creams. Maybe they helped. Maybe antihistamines helped. Then you went to then you had puberty, and then all of a sudden you have no rashes, but now you have seasonal allergies. That's a classic atopic scenario. Sometimes they switch from when you're younger to when you're older, the kind of allergy switches. But atopic really just means you have a predisposition for allergies. That's the main reason for it. And then there's just familial disposition towards allergies. But one thing to know is the allergy that your parents have might be different than the allergy that you have. This is also true with autoimmune conditions, which are different. We discussed them. But the autoimmune condition that your parents have, you might be prone to autoimmune, but they might have had lupus and you might have rheumatoid arthritis. So those are just more things to know about this. So let's go through the symptoms. Most of you will know these very well. So we'll start with nasal symptoms. And the first is called allergic rhinitis, which all of us will call stuffy nose or runny nose. Rhine means nose. Rhinoplasty is plastic surgery to the nose. Rhinoceros. I'm not sure what does saurus mean. I'll skip that for now. So nasal symptoms are runny nose, stuffy nose, sneezing, post-nasal drip, mucus going to the back of your throat, and itchiness, itchy nose, itchy throat. The next group of symptoms are eye symptoms. This is because we have lots of histamine, lots of mast cells. That's what's happening. So eye symptoms include itchy eyes, watery eyes, red and swollen eyes, red eyes, swollen eyes. By swollen, I really mean suborbicular, just around the eye. Skin symptoms include skin rashes, wheal and flare. Wheal is W-H-E-A-L. You can actually test for a wheal and flare reaction. If you take like a part of your body and you scratch it, for those of you who are allergic, what'll happen is it'll become raised and pale on the inside and red on the outside. That's called a wheal and flare. Sometimes it's called a wheal, W-H-E-A-L. So some of you, when you get bit by mosquitoes, right, or any insect, you don't just have a small bump, you have a raised bump and a red area below it, or yeah. So that's called a wheal and flare. Also hives. Hives are small, raised, itchy bumps. They can be very, very itchy. I've seen people with like full-on whole body hives, and it drives people crazy. It's just very itchy. And just itchy skin without hives. Respiratory symptoms. They include a cough, wheezing, shortness of breath, and chest tightness. What I'm doing now, I'm talking about the most common symptoms associated with type 1 hypersensitivity or allergic responses. And then you can have other symptoms. I'm going to describe some of these. This is not anaphylaxis. We'll still get into that a little bit. So other symptoms include headache, nausea and vomiting, diarrhea, swelling of the lips and tongue, fatigue, and just general achiness. A lot of the other symptoms, a lot of those are often late stage allergies, which again, we'll get to. So what I want to go to now, and then we'll jump to herbs pretty soon, is early phase versus late phase reactions. I've mentioned this a few times, and I want to go into it in a little more detail. So with early phase reactions, this is really what everybody thinks of as allergies initially. Everything I just said, itchiness, mucus, cough, hives, wheeze, fatigue. These are your common responses to early stage allergies. Pretty much everybody with allergies will have these allergies at least. But many people will have some of the time, or sometimes all of the time, will also have late phase reactions. Those early phase reactions are due to histamine and serotonin, those chemicals I mentioned previously. We could just say histamine at the moment. But your late phase reactions, which often include sluggishness, swelling of the face, the same symptoms as early phase, but worse. But really, people just feel much more tired and might be more swollen. These often last longer. And it's because the cells in your body that created the early phase reaction then bring in other cells. One of the cells that they bring in are called eosinophils. Eosinophils means acid loving. Eosin means acid, phil means loving. Eosinophils, and they create inflammation. So the reason that this is important to know is that early phase reactions, antihistamines are going to be one of the major sources of medicine. Again, we'll get to herbs. With late phase, anti-inflammatories are going to be more important. Antihistamines have a little bit of play here, but you're going to need more anti-inflammatory herbs. We'll cover herbs shortly. So, but that's why it's helpful to know. I mean, you will know it if you have this, because initially you're like, oh, this kind of is not much fun. And then later, like, oh, I don't have an appetite. I feel swollen. I am swollen. But this is not anaphylaxis. That's entirely different. Skip this. I want to go over anaphylaxis a little bit. I don't want to spend much time. We have about another hour and a half, and I want to make sure I spend the rest of it on plants. Sometimes I don't do well. So give me a moment here. Where's my anaphylaxis notes? So anaphylaxis, again, it means up the protection. What it really means, the immune system has gone overboard, is deadly. One of the more common things that causes anaphylaxis is going to be bee stings or hornets. And when I say bee, I mean all the Hymenoptera: bee, yellow jackets, hornets, wasps, because they inject the venom into you. So the reaction is stronger. But you could have anaphylaxis from food. I remember watching a cousin going through anaphylaxis after eating a couple of sesame seeds, which is a seed that causes allergic reactions. So anaphylaxis is the same. The first stage is sensitization, and the second stage, the subsequent exposure, is just much worse for it. And there's lots of symptoms, but instead of going on over them, I want to say the two important ones that you have to look out for. First, you should know that often before people are anaphylaxis, they start to show signs, and their sign is often prevalent itchiness around their body. They get really itchy. Because at this point, you want to get your medicine out. And if you are anaphylactic, again, it's terrible how much it costs, but those injectables are life-saving, and you want injectables because it's going to be difficult to swallow. And there's really nothing to swallow anyway. So get those injectable epinephrine injections. So there's lots of components to it, and I suggest reading about anaphylaxis. But two of the major ones is that it's very difficult to breathe. So you're losing oxygenation. And you have what's called circulatory shock. And what happens in circulatory shock is during anaphylaxis, your blood vessels relax. When your blood vessels relax, the blood goes from inside the blood vessel to the nearby tissue. This is going to cause redness and swelling. But as the blood goes to your nearby tissue, you have less blood circulating. What your heart is going to do is going to pump much stronger. You're going to go into a rapid heartbeat because with less blood, your heart detects less blood. And so it wants to circulate the blood you have in you to make sure that all of your cells get oxygen. Your classic sign of anaphylaxis, if you take a pulse, is a very fast but very thready pulse. There's not a lot of blood, but it's going very fast because your body is trying to compensate. This can lead to dire consequences. Epinephrine reverses both of these things. So epinephrine, also known as adrenaline, epinephrine causes your blood vessels to constrict, keeping the blood within your blood vessels, and opens up your bronchi. So it allows you to breathe easier. So I've only seen anaphylaxis a few times at first aid events. I'm not going to see it in a clinic. People are going to get hospitalized. If you're unsure, I mean, 911, they're going to have epinephrine, but you have to give it pretty immediately. So, and also after the person comes to, so if you when you give the epinephrine, they will then because often they're going to pass out. A lack of blood going to their brain is going to cause people to pass out, right? You give them the epinephrine injection, and often they'll come to, but you have to realize that they can have further, uh, further symptoms. It can happen again. One thing to do as soon as they come to is to give them Benadryl and then watch and wait for a few hours. For us at a first aid station, after they come to, we'll give them Benadryl, then we'll bring them to the first aid station to keep eyes on them as long as we can, for a day if possible, for at least a few hours. If you're at home, a hospital might be a good choice. Of course, hospitals bring a whole set of problems because they're expensive and long waiting rooms. I've watched The Pit a few times. I've watched almost all of The Pit, and that has just made me to ER rooms. But I don't know if anybody else has watched that series. In some ways, it's realistic, a little bit tightened. Anyway, so that's anaphylaxis. There's the only answer for anaphylaxis is an EpiPen, hospitalization, or getting somebody to emergency. Don't bring them to a hospital. Get an ambulance, right? Have somebody come to you. They're going to have the epinephrine. Unfortunately, of course, there'll be a big bill. All of that's involved, but you're saving a life, and also like that person will come fully to, right, with it. The other thing to do is to just buy it. Unfortunately, they're regulated. They don't sell them over the counter. But if you're a medical person or know somebody, usually you can find a way to get a prescription for them. That's it for anaphylaxis. All right, another sip of tea. How y'all doing? Doing all right? So now we move towards treatment. So a lot of these things, before I go to herbs, a lot of these things are going to be very hard to do. Um, but I'm going to suggest them anyway. The first is where the real way to not get allergies is avoidance. It is the only way to not get allergies, really, is avoiding them. I mean, we could talk about different sensitization techniques, but really avoidance is the main one. So the main way to avoid is wearing a face mask and a good quality one. But really the main thing is it's just got to seal, right? It's not that it has to be it's pollen, right? So it's not tiny microbes like a virus, but it's got to seal around your face. So that's one. If you're someplace where there's furry animals and you're allergic, at least don't touch them. Because if you touch them and then touch your face, which people do all the time, you can have allergies. You might have allergies anyway, just from breathing it in. Uh, cleaning, cleaning bedding on a regular basis. After you're outdoors, when it's not right now, but in the next weeks, depends where you live, wash your hands and face with some soap. Don't use antiseptic soaps. You want soap and water. For this. You're not trying to kill something. You're trying to remove any allergens from your face and your hands. Even if you don't have that, it's just a little bit of soap, a little bit of water, and rinse to get it off to help the allergies going into your body. And for me, I talk to patients about there's a lot of allergy medicines, just discussing those allergy medicines with people. All right, believe it or not, we're going to move to herbs. First, I want to cover the different kinds of preparations, and then we'll go into specifics. So there's really a lot of kinds of preparations you can use for allergies. They include capsules. Capsules are very slow acting. That's the problem with capsules. You're going to take capsules if you're trying to help long term. Compresses. Compresses sometimes putting crushed up plants, in tea and putting that on your body to soothe itchiness. Doesn't usually help that much. It's internal. You can take glycerites internally, plants. I'm going to talk about the different kinds of plants. These are just preparations. There's honeys. You can make plant honeys, tinctures and teas and vinegars. In other words, there's a lot of ways to put plants on your body, but the majority of the time, when you're trying to treat allergies, the medicine is internal because either you're trying to damp down a histamine response or you're trying to damp down an inflammatory response. And as somebody just mentioned, another way to do it is neti pots. Sometimes you have to be careful because neti pots can actually bring pollen deeper into your sinuses. So just learn how to use a neti pot well to basically rinse out the inside of your nose. So again, we have capsules, compresses, glycerites, honeys, neti pot, steams, tea, tincture, and vinegars. This will probably be posted, so you don't write it all down. Though still, I appreciate people being here. Even though you all might be AI, I might be AI. And if I am AI, I feel bad for the world, right? I feel like if this is what AI can produce, we're in for a lot of trouble. So again, we're going to go with early stage allergies, antihistamines are going to be your main choice. For late phase allergies, it's going to be anti-inflammatories. But now we're going to go into specific herbs. So there are three main herbs that I find helpful for histamine-induced allergies. They might be antihistamine or kind of antihistamine. I don't really know how they work, but they're the three herbs that I see help the most when people have itchy eyes, runny nose, itchy throat, itchy ears, hives. And so I'm going to cover these three herbs in more detail. So the first one is always a shocker, and that is ragweed. So ragweed is Ambrosia artemisiaefolia. Ragweed is the botanical name of ragweed is ambrosia, which is weird. Artemisiaefolia, which means leaves like mugwort, which it has. And yes, so ragweed is the #1 seasonal allergy producer anywhere that ragweed grows. It's a native plant. It's a native plant to a large section of the northeast of the east of the United States. This is not a case of what hurts helps. This is just one of those funky things where something does hurt, does help. So the reason I don't want to go into it. I do want to go into it, but it'll be 10-minute rant. And AI says stay on topic. So I think AI is not supposed to act like a robot. So ragweed is one of the stronger antihistamine herbs. I'm going to spend a few minutes talking about it. So again, this is the plant called Ambrosia artemisiaefolia. Or if you live in the Southeast, you might use giant ragweed, which is Ambrosia trifolia. So these are both called ragweed. Giant ragweed grows up to 6 feet. The common ragweed is maybe 2 feet at most. They're both, of course, wind pollinated. Pretty much every plant that you are allergic to is wind pollinated because the pollen has to be light enough to float in air. That's the job of that pollen. So ragweed is wind pollinated, and the leaves of ragweed just have an antihistamine effect. It's a weird one and a helpful one because it's such a common plant. So the first question I pretty much always get is, I am allergic to ragweed. Can I take ragweed tincture? And the answer is yes, you can. Don't ingest the pollen, right? So the leaf is not allergenic. Only the pollen is allergenic. So gather the ragweed before it goes to pollen. I have lots of pictures. I might even have a whole blog about ragweed, but you can find out lots of sources from it. So when the plant is yay tall, but before the flower stalk comes out, the flowers are very small and not that conspicuous. Learn what they are. Just look up pictures of ragweed, and then take those leaves before they, and then actually tincture them fresh. And they help a lot of people with allergies. The one problem I've seen is that often people build up tolerance within a few weeks to a few months. So initially, it's like, hurrah, this is helping my allergies a lot. But then 2 months later, unfortunately, it doesn't work. So you want to have other herbs to help. But it is, out of all the plants that are safe, ragweed is the most effective plant I've seen for allergies, as well as many other herbalists. The next plant that's maybe 2/3 as strong as ragweed, but doesn't have this scary, I cause allergy things, is eyebright. So eyebright is the genus Euphrasia. Euphrasia, which means to make happy, to make happy. Eu is good, Phrasia is mind. But eyebright can also be very helpful. I want to say that I'm not going to go into medicine making at all. So I'm going to say how to use these plants or when to use these plants. But in order to cover all the plants I have in the next half hour, I'm not going to go into any medicine making. So eyebright is also very helpful, and it also has an antihistamine-like effect. So the main reason I use eyebright, so where I live, you can see Tracy, if you can see it next to me there, lives in the Adirondacks, and eyebright has become a weedy plant in parts of the Adirondacks. And so when I go visit Tracy, it's a non-native eyebright that grows there. The reason I'm saying this is because a lot of people say that eyebright is a scarce protected plant. That is true for the native eyebrights. For some areas, not like if you live in Maine, often it's scattered all over the place, just like in the Adirondacks. And so learn your eyebrights, learn your non-native eyebright, and then you can gather it freely because it comes back from seed. It's an annual. But eyebright is almost as effective. And I like to use eyebright because if people ask me what I'm giving them and I say ragweed, like it just makes their allergies worse just hearing the word ragweed, even though the tincture itself will not increase symptoms, right? Because it's just a leaf. So the dose of eyebright and ragweed and many of these safer plants is going to be something like a half a dropperful, which is 1 ml, a half a dropperful to 2 full droppers. So 1/2 milliliter to 4 milliliters. Put that 1/2 dropperful to 2 full dropperfuls, 1/2 dropperful to 2 full dropperfuls, taken as often as necessary. The plants are very safe. Your biggest side effect is going to be the alcohol. So don't give these plants to people who are sober, right? Or who don't take alcohol for any other reason. Don't give tinctures to anybody who's not imbibing alcohol for any reason. So, but generally your dose is something like 1 full dropper, 2 milliliters, 1 full dropper, 2 milliliters, usually about 4, 5, or 6 times a day during the heavy season. The next plant is stronger and has quite a few side effects, but I'm going to cover it. Also, I might go a little past 3 o'clock today. I apologize. I'm looking at my time. I thought I had it timed well. I never think I have it timed well. So the next plant is called Mawang, Mawang. That's the Chinese name. More commonly, it's called Ephedra. And there's 2 species of Ephedra that are used. So Mawang is a Chinese name, and Ephedra is the genus of the plant. But it's important to realize that there are many species of Ephedra that grow in the southwest of the United States in drier climates, but are not very effective. Unfortunately, the ephedras that are native to the United States, sometimes they're called things like Mormon tea, don't have a lot of ephedrine, different than epinephrine. They have ephedrine, not epinephrine, the ephedrine, and don't work nearly as well as the plants that grow in Asia. So, and those are usually called Mawang. And there's 2 species that are commonly used. Those species are Ephedra sinica and Ephedra equisetifolia. Equisetifolia means horsetail-like. I'm going to keep going. So, sorry. These things have these plants, these Mawangs, have strong antihistamine action. They're also very strong decongestants. and some of the strongest plants to reduce hives. But they have serious side effects. This is not an FDA moment here. This is just, as an herbalist, you will see these side effects. So ephedra is what's called a sympathomimetic. Sympathomimetic. It means it mimics your sympathetic nervous system. It puts you into a minor state of fight or flight. It's going to raise your blood pressure depending on dosage. So it can cause anxiousness, accelerated heart rate, and headaches. So be very cautious, or don't use this with anybody who's hypertensive or has high blood pressure. So I carry ephedra because it's so useful, but you got to be careful with your dosing. So you're just going to start with like 5 drops. And I don't know if you even want to give it to children or people who are frail or people who are hypertensive, high blood pressure. But it's the one that works really well. If you took it before sleep, you're not going to sleep for most people. Again, all of this has to do with dosaging. So start with 5 drops. I make a tincture out of it. I've made a glycerite, but haven't tried it. You can also make a tea and take a little sip of the tea. It doesn't have caffeine. It has ephedrine and what's called pseudoephedrine. So what was it called? Do you remember the drug that used to be over the counter called Sudafed? Sudafed was originally derived from this plant. That's why it dries you up. So Sudafed is made from pseudoephedrine, ephedrine as in ephedra. So just a little bit of history there. But then people started making methamphetamine from it, so then it went behind the counter. But that's a whole other story. So I'm name a bunch of plants coming up, but the 3 main plants, this whole class that you sat through to come to these 3 main plants, are really what I find the most effective. Ephedra, start with ragweed and eyebright, very safe. And then ephedra. I tend to use ephedra if the symptoms are much worse. Like that person I said who had full body hives, I gave ephedra to them. Or if the person is really overly mucousy, it will really dry them up. So it will dry them, it could dry you up uncomfortably dry. So I'm about to cover other plants, but those are your primary plants in your first aid kit. But don't use ephedra until you've learned more about it, not just what I am teaching in this class. It has potential to cause serious side effects: anxiety, elevated blood pressure, headaches, and all the other things associated with elevated blood pressure. This is not this is a real warning, and you will see it. But in small doses, generally safe. By the way, it's very difficult. It's become, I forgot its regulation. It's not allowed to be sold. It's not a scheduled substance. So if you have it, that's not illegal, but they've made it very hard to buy it because of problems with it. So I don't have a good response to that. I had a friend that lived in China, and whenever he came to the United States, I would just ask him to bring me a few bags, which is not going to be readily accessible for everybody here. So there's a couple more plants that do have mild antihistamine-like effects that you can definitely try. Here they are. So there's nettles leaf. Nettles leaf is tea. Nettles leaf is tincture. And goldenrod. So nettles is urtica species. Goldenrod is going to be solidago species. So nettles is urtica, goldenrod is solidago, and there's no poisonous members of the goldenrod. There's lots of goldenrods. I have only tried 1 or 2. They're very common here, but in general, goldenrods are very safe. Both of those plants, nettles and goldenrod, are also very rich in antioxidants. And there are some good studies that show if you take in a lot of antioxidants, it can reduce the severity of your allergies. We'll talk about other antioxidants soon. And really, goldenrod and nettles are helpful. They might make you pee a little bit extra. Both are diuretics. So that's my list of antihistamines, but now there's a lot of other categories to cover. So the next group, and again, I see a lot of words. I'm hoping people are answering them. I'm sorry to not be present enough to answer questions. are anti-inflammatories. So if you have late-stage allergies, these are, by the way, just in alphabetical order. If you have late-stage allergies and you're swollen and fatigued, those are the two main things, and just full of mucus, these are some herbs that can help you. And these are just general anti-inflammatory. I want to just reiterate, Ephedra is problematic, but pretty much no other plant here, unless you have a specific reaction to it, is. Ephedra is the biggest, is the scariest plant, also a very effective plant that I'll discuss. Back to anti-inflammatories. Ephedra is not an anti-inflammatory. So here are some anti-inflammatory plants that you can take for the sluggishness and for the swelling that can happen. So they include black birch. I think I'm going to not go over all the science. I need to go over scientific names. It's kind of against my credo not to give them. I'm a botanist. So black birch, which is Betula lenta, it's the bark of that plant, which is delicious smelling. It's wintergreeny. Meadowsweet. These are anti-inflammatories. Filipendula ulmaria. Licorice. Glycyrrhiza species. Trader Joe's licorices don't work. They kind of work for me, but just as something to chew on while I'm writing. Licorice can also raise blood pressure. So licorice will, for certain people, for licorice, it will make your body hold water. When your body holds water, your blood pressure goes up because you have more blood volume in your blood vessels. So licorice is another one to be a little bit cautious of. Avoid licorice for people who have high blood pressure. Read more about it. I've written bunches about it. So there's lots of safe ways to use licorice, but if you haven't read about it, the easiest thing is if you don't give it to people with high blood pressure, you're pretty safe. In fact, licorice can be very helpful for people with POTS, POTS, or low blood pressure for the same reason. But for here, I'm talking about it as an anti-inflammatory. There's one more group of people that won't take licorice, and those are the licorice haters. And they're out there, and they're in front of me right now. Raise your hand if you despise licorice. Be brave, say it. Yeah, there you go. So we got like 5 or 6 hands at just this group. So fortunately, there's other herbs besides licorice. So yeah, but yeah, when I always ask people if they hate licorice, and the licorice haters love to get into their licorice hate, and I like watching it. So so there's that. And all right, out of licorice. Be careful with licorice with people with high blood pressure or with people who just despise the flavor. Then we have chamomile. Some people are allergic to chamomile. The symptoms to chamomile allergies are generally pretty minor, but then they should just avoid chamomile. But chamomile is anti-inflammatory, so it's helpful there. Another one is Japanese knotweed. So Japanese knotweed, Rhinotria japonica, Japanese knotweed with a K. Rhinotria japonica, it's had a lot of scientific names. Is an excellent anti-inflammatory and one of the richest plants of resveratrol, which is a strong antioxidant. I'll say that again. So Japanese knotweed is anti-inflammatory, but also very rich in an antioxidant called resveratrol. It's just rich in an antioxidant. And despite it being one of the most aggressively weedy plants that you should never plant anywhere ever again, is really medicinal and really anti-inflammatory. A few more. Turmeric is a good anti-inflammatory to take on a regular basis. And we have ginger. There's lots of others. So basically black birch, turmeric, meadowsweet, licorice, chamomile, Japanese knotweed, willow, ginger, and yeah, those are some. And I didn't mention it, but willow species, Salix species or willow. So I'll be going through a bunch of lists of herbs for different categories. The next group of herbs are antioxidants. It just looks like if people have more antioxidants in their diet, that they're less prone to allergies, or at least the severity of their allergies. The real way to get more antioxidants in your diet is very easy. Eat vegetables. So this is not an anti-meat moment. This is a pro-vegetable moment. Pretty much all vegetables, all plants are very rich in antioxidants. I'm going to go over some specific medicinal herbs that quote for some reason. But really, fruits and vegetables are just very rich in antioxidants. You can't even cook them all out. But some other ways to get them, if you're interested, are things like cayenne pepper, very rich in antioxidants. And if you're somebody like me who loves spices, an excuse to overspice your food. Ginkgo biloba, which has other effects as well. Lion's mane mushroom. Lavender. I tend to keep lavender at a lower percentage. This is very strong tasting, but lavender is an excellent antioxidant. We're back to Japanese knotweed. Garden sage, Salvia officinalis, garden sage, kind of strong tasting. Rosemary, one of my favorite to use because it has so many positive effects, but Salvia rosmarinus, or rosemary, the rosemary plant. Again, like lavender, rosemary and lavender should just be smaller percentages of these plants. Sorry, lavender and rosemary, you just don't want to take a lot of them. They're just very strong tasting. I mean, I've over sprinkled rosemary in potatoes way too many times, where you just do it extra like 6 sprinkles, and then all of a sudden the potatoes are just all rosemary, no potato. So all rosemary, no potato. That will be the theme of my restaurant. Next will be elder. Elder fruits. Elder, the flower is good, but the fruit is better for the antioxidant action. And back to goldenrod and nettles. The next are herbs for coughs. So these are technically called antitussives. You don't have to know that word, but they're cough remedies. So one group of plants that are good for coughs are what are called demulcents, or slimy plants, because they just soothe the mucous membrane. The 2 main slimy plants for cough remedies that soothe the mucous membranes and reduce it are marshmallow root and slippery elm. Make sure to get the slippery elm from a reliable source. And I write to companies. When I see them selling it, I'll write to them and say, where do you get this from? You can do that, right? And then you have to see if they're just giving you PR bull or not. Other cough remedies, there's a couple of resinous plants that are really good for coughs as well. They include yerba santa. I'm going to say it and not spell it. So the genus of yerba santa is Eriodictian. Eriodictian. And another resinous plant that's good for coughs is gumweed, like gum. I don't really want to point to my gums, which is the genus Grandelia. I want to say I see a lot of people asking for spelling. I'll try to make a handout in the next week or two to at least get the spellings of all these herbs, and then I'll post it on social media. I use Facebook and Instagram. So if you go to them, and I'll just try to get at least like a Materia Medica plant plus a botanical name list there. So gumweed and yerba santa are resinous plants that are really helpful for coughs. A common garden plant that's really good for coughs is thyme, Thyme. So I'm going to say something that sounds a little rude. I am from New York, but I feel the need to say it. So I'm only occasionally looking at the participants' comments that people are making, the chats. I am not saying that any of them work or don't work. So I just want to say that people are saying the things that work for them. I haven't been reading them, but please parse out information, so that I really appreciate people inputting information. I also just want to be extremely clear that that just because it's associated with this and you're writing it down, I have no idea if it's helpful or not. I haven't read it. So uh, critical thinking as much as possible. Back to coughs. So a couple of other plants that are really good for coughs is elecampane, which has become weedy in Ithaca, New York, which I appreciate. So elecampane, Inula helenium. Um, Elecampane is actually an anti-inflammatory to the respiratory tract. So it's kind of exceptionally good for coughs due to inflammation. Not always that great for just type 1 allergies. One of my favorite cough remedies is wild cherry bark. So I only use it fresh. You can make a glycerin or a honey. Honeys and glycerins are great for coughs because they soothe the throat as they go down. Or you can use the wild cherry as a tincture. But the thing about wild cherry for coughs, it's really useful for coughs. It's particularly useful for what's called hectic coughing, which is you kind of can't stop the coughing, but it's minor, it's not as mucousy. That's where wild cherry bark really works well. Again, though, it works really nice as a glycerin or a honey. Learn how to make those products because just taking it, just the soothingness on the throat feels good. And one more, so that's Prunus serotina, wild cherry's Prunus serotina. And one more, well, a few more. Two plants that are very common in the wild around here are mullein leaf. If you make a tea with the mullein leaf, make sure to strain it very well. Mullein has a lot of small hairs on the leaf, and if those hairs get in the tea, they definitely irritate coughs because basically you're just drinking these little hairs. So if in a tincture, you rarely get that if you press out your tincture, but in teas, I've seen people just get irritated coughs from mullein tea. So just strain it really well is all. Then coltsfoot leaf is another cough remedy. So all these are various cough remedies if you have a cough associated with your seasonal allergies. That's it for that. The next group, these are anxiolytics. These are herbs that help with anxiety. I know nobody has anxiety. Fortunately, we've stomped out anxiety, and now everybody is in stable moods all the time due to the beauty and effervescence of all of life. I'm going to have to stop there. My sarcasm is surely going to go to a dark spot or a negative spot very quickly. Anyway, here are some plants that, as you have allergies, might also just make you anxious. This is not to be used from the anxiety due to anaphylaxis. You always have anxiety. When people are anaphylactic, they are very anxious because of the seriousness of their body. You can give them anxiolytics later, but initially you just got to get the blood back in the bloodstream and get their throat back open. So I just want to say that often when I'm working with people who have allergies for long term, they often have some anxiety associated with it. Here's just a few herbs that can help with that. They include passion flower, Passiflora incarnata. Something stronger would be kava kava or just kava. Piper methysticum. Rose. I particularly like rose petals and rose buds. Skullcap, again, a little bit stronger. These are things to quell anxiety for any reason, but for this, I'm putting it under anxiety sometimes associated with allergies. Damiana, which is Turnera diffusa. And I'll name one more. If you read the stuff I write, I constantly talk about herbs for anxiety because I feel that one place that herbal medicine is really helpful is anxiety. And to go against my recent sarcastic rant, anxiety is one of the most common things that people come to the clinic for. Even if they don't come in for anxiety, anxiety is a background noise for everybody. It doesn't matter what your persuasion is. There's a background noise of anxiety in the world we live in, maybe always. And so the last one is linden or tilia. Linden is sometimes called lime flower. It's not the lime tree. It's not the tree that makes the yellow fruit called lime, but sometimes it is called lime. But the genus of tilia of linden is tilia. and there's lots of it. They're often grown as street trees because they do well in this. So once again, I'm going to keep going. I'm going to go over my 3 o'clock limit. If you need to leave, please. I can fully understand it. So the next are bronchodilators. Bronchodilators are herbs that help open up the bronchi. If you're wheezing, you have closed bronchi. So these are particularly good for asthma. So I didn't go over all the different kinds of allergies, but one kind of allergy is asthmatic allergy. So there are a number of causes of asthma, and one cause of asthma are allergies, right? Because pneumonia can also bring on asthma, and other infections can bring on asthma, but we're talking about allergic asthma. So, of course, like everything else, one of the main helpfulness for allergic asthma are antihistamines. But if you're wheezing, generally you're wheezing on the exhale, right? So you make that noise. I'm not going to make that noise because basically your throat is constricted, there's inflammation, and you have mucus in there. So through those three things, bronchoconstriction, inflammation, and mucus, it gets more difficult to breathe through your breathing tubes, which are called bronchi. There are two herbs that can help open up the bronchi. They are, I'll start with one and then go to the other. The first is lobelia. So this is Lobelia inflata. It's a native plant, also not that hard to grow in a garden. Lobelia inflata. I don't use any, there's lots of lobelias. The only one I use is Lobelia inflata. Sometimes it's called pukeweed and other very similar names to that. I want to spend a few minutes on lobelia. So first, lobelia has a reputation for making people vomit. And in all my years of giving lobelia, I've never seen anybody vomit, but I have stories from people that I believe have vomited from it. So first, don't drink lobelia tea. It is very acrid and can cause vomiting. So we're talking about lobelia inflata. The tea is acrid, means it's kind of burning and acidic in the throat. So avoid lobelia as a tea. And I would suggest there are two preparations to get in people's bodies. They are lobelia tincture and lobelia vinegar. Lobelia is just famous for also working as a vinegar tincture. Lobelia is a very reliable plant as a bronchodilator, as relaxing, opening the bronchi up, not anti-inflammatory, relaxing the bronchi, making breathing easier. It's a little bit like the emergency inhaler called albuterol. It is not albuterol, and this is not an anti-albuterol moment, but I'm saying it's used that way. As opposed to something protective, you take lobelia if you're having trouble breathing. If you're having really bad trouble breathing, seek medical care. I mean, one must breathe to live. So this is your wheezing. You've had this before, and maybe you use albuterol, and you want to try an herb. The first herb that I would suggest is Lobelia inflata in tincture form if you drink alcohol, and then in vinegar form if you don't drink alcohol. It is acrid. If you take the tincture, I can say way too much about lobelia, but if you take the tincture and it hits the back of your throat, it'll make it a little bit itchy and irritated. So make sure it goes in, like most medicines, it goes in the front of your mouth. I'll go for the dosage with lobelia. So generally, what I'm going to do is start with about 10 drops. For a child, a lower dose, of course, but anywhere between 5 to 10 drops. I usually give it directly to the person's mouth, the tincture, if alcohol is acceptable. You can just start with 5 drops if you have any consideration. And then what you do is you just keep giving like the 5 to 10 drop dose. So somebody's having trouble breathing, you give them 5 to 10 drops and ask them how they're doing 2 minutes later, seconds later. And they say, breathing a little bit better, then do it again. Give them another 5 to 10 drops. Wait another 2, 3 minutes, see how they're doing. And I have to say, I'm still doing a little bit better, but I still have a little bit of trouble breathing. Then do it again. Usually after 3 or 4 times, you reach a plateau where it doesn't help anymore. And then at that point, I would just stop giving it. It's not going to help. So in other words, instead of giving a lot at once, I give it in kind of medium, small doses, and I just keep giving it until either the person is not wheezing anymore, which happens, or more is stopped helping. And then I just stop it from there. Lobelia does lots of stuff. Again, I've written lots about it. I think it's one of the most interesting medicinal plants because of how it affects the parasympathetic nervous system. But for now, I just want to say, as a bronchodilator for asthma, one of the best plants. It's just, and it's pretty safe to use. The other plant we talked about already, but also is a really strong bronchodilator, maybe stronger, is Ephedra. So Ephedra, I mentioned that thing, I called it a sympathomimetic, meaning it kind of initiates a sympathetic or fight or flight movement. But when you're in fight or flight, your bronchi dilate, they open. And Ephedra does that. So it stimulates the bronchi to open, but it has all the negative effects that I've already said. It can create anxiety. It can raise blood pressure. It can cause headaches. It can just be very uncomfortable. But I find that generally Lobelia does it, so I don't have to give Ephedra, but I carry the Ephedra anyway as a secondary. These are the only two herbal bronchodilators I know, Lobelia and Ephedra. And Lobelia is the easier of the two. The next, we probably have about 10 or 15 minutes left. I just want to say it because, yeah, because I just keep my eyes on time too much. So the next group of herbs are decongestants. Help dry you out. So nice to see some sunshine today. So these are herbs. Some of these are helpful to apply in neti pots or a spoon or any way to get it into your nose. But often you can just put them in your mouth and they have a systemic reaction and dry you out. So here are some decongestants. The first one is yerba manza. Yerba, meaning herb, manza, I think it means, I'm not sure what it means, brown. Yerba manza is Anamopsis californica. Anamopsis californica. It's a southwestern plant. Also, make sure you get that. Make sure all your herbs are from reliable sources. But we don't want to be, nobody's growing yerba manza that I know, so if it's being wildcrafted, you have to be really careful. So I'm just going to go through a bunch of plants that I find useful for drying out your nasal secretions. The next one is a little bit tricky, but fun, and it's horseradish. Oh, hand. Thank you. So horseradish, which is Armoracea rusticana, you can just write horseradish. But horseradish clears out the sinuses. Sometimes it initially instigates nasal secretions, but in the end often dries them out. So you can buy like Gold's horseradish. You can make your own horseradish. You have to be careful. I mean, horseradish is weedy where I live. I have to constantly take it out of my garden, which is a little bit nice, but also kind of weedy. It's a big root. It just keeps coming up every year. It's a pretty plant, another mustard family. So horseradish. The next are beggar ticks. Beggar ticks. It's because the seeds stick in fur. That's why they're called beggar ticks. You will know this genus. You've heard it previously for a different reason, but the genus is Bidens. Bidens. It's somebody's last name, just like it was somebody else's last name. I really like Bidens. They're very common. You might not know it, but they're often growing in culverts, and they're pretty weedy in many places around the United States. If you live in the South, you might look for what are called Spanish needles, which is Bidens alba. But there are many different forms of beggar ticks, and learn them around you. They're not bad tasting. You can drink them as tea. They are native. All the ones I know are native, but generally they're pretty common. So you can gather them, tincture them, dry them. So again, beggar ticks or Spanish needles plants in the genus Bidens. The next one I've discussed so many times, so I'll just say it quickly. Ephedra. Ephedra is the strongest decongestant I know. It just dries the heck out of you. So, and it has all those negative side effects, raising blood pressure, causing headaches, raising anxiety, increasing sleeplessness. So be careful. But it is a drier outer. The next one I've discussed previously, another one, and that's going to be Yerba Santa again. Yerba Santa. There's two plants that are both good for coughs and are good as decongestants. Yerba Santa is one of them. And the other is gumweed. So I mentioned gumweed, Grindelia species, Yerba Santa, Eryodictian species. Both of those are antitussives or help reduce coughing and also dry you out. And they're pretty safe. I think that's good list for that. The next group of herbs to consider are just emulsants, just to soothe your digestive and respiratory tract. Basically, you're adding slime onto slime. Sometimes it seems counterintuitive to take slimy stuff if you're slimy already, if you have a lot of mucus, but that's not true. When you make a lot of mucus, you might have irritated mucous membranes. By adding the emulsant plant, a slimy plant, into your digestive tract, it reduces the irritation of the mucosa, which can help make you a little less runny. So even if you make a lot of mucus, you still might want to consider taking a demulcent plant like marshmallow root, slippery elm, or licorice. Again, licorice can raise blood pressure by making the body hold water. And if you're having difficulty sleeping because you have allergies, there's about just a few more minutes left here. If you're having difficulty sleeping because you have allergies and you're sniffling and sneezing and coughing, these are some herbs that can help with sleep. They include hops, Pipermethysticum, kava. Wait, I'm sorry. Backwards. Hops is Humulus lupulus. This is what happens when you have an AI glitch. Hops is Humulus lupulus. Kava is Pipermethysticum. Skullcap is Scutellaria species. And Valeriana officinalis, valerian. So if you need herbs that just help you sleep, 4 herbs to consider are hops, kava, skullcap, and valerian. Nearly to the last category. So I want to mention expectorants. These are things that help bring mucus out of your respiratory tract and sometimes reduce allergic symptoms and reduces coughing because you just have a lot of mucus constantly dripping in you. So decongestants dry you up. Expectorants make you kind of puke out the mucus, I guess, or cough up. A sweeter way of saying cough up the mucus. First, we have our 2 old friends, gumweed, Grindelia species, and Yerba Santa, Eryodictian species. These are expectorants. They fit a number of categories. We also have hyssop that often people grow, a kind of skunky smelling herb that people grow in their gardens. Elecampane is showing up again. Elecampane, Inula helenium. OSHA, which I haven't mentioned much, actually has a bunch of respiratory action, but OSHA, which is Ligusticum porteri, Ligusticum porteri. There's other Ligusticums you can look up, but it helps bring mucus up. Actually, sometimes, just to put it in there, sometimes OSHA helps when people are having difficulty breathing. So OSHA, the plant I'm mentioning now, I haven't really mentioned much, but sometimes it also can help increase people breathe, but I'm mentioning it here as an expectorant. Lobelia inflata, which I've covered recently, is a really good expectorant, bringing mucus up, coughing it out. And the last one is skunk cabbage. Skunk cabbage, Symplocarpus foetidus. And I think that's it. So I'll look at some, there's going to be a lot to look at. I think looking at questions will take a lot of time. Um, and I'm not sure what I would read anyway. So I'm just going to say, I hope that some people answered the questions. I'm really hoping that this was helpful and that you can make it your own first aid kit and start treating allergies better. I hope you have a better understanding of what allergies are. If you're interested, go look at my database. I'm pretty excited about it. It is not finished. It is like 1/1,000,000th of a way finished. And I'm not going to put AI into it. So it'll take a lot longer to make. But that's just on my website. And I think that I'm going to say goodbye. I'll sit, I'll wave and listen, watch the thank yous because they're so nice to read. But thank you, everybody, for being here today on Sunday.